Hi everyone, this is Shalini Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. I'm back with another NMC OSCE video for you. So if you like my videos, please press the like button now and subscribe to my channel. And keep sending those comments. They really help to understand that what kind of questions you have on these videos, and I've been answering them as many as I can. We also deliver the OSCE training for NMC, so in our training center. So we do give training online as well and face to face. So if you need more information, then do email us. Okay, so today's video is all about I'm going to cover the community scenario for adult NMC OSCE. So I will cover the community scenario for a diabetic patient. You've been asking me for a long time. I did one for Alzheimer's and it was a very popular video. So this time I'm going to cover diabetic patients. So we're going to talk about a diabetic scenario and what you're expected to do in that scenario, and going to give you my tips how to carry out that assessment for a patient who is in community and you've been asked by the GP to go and do an assessment on this patient who is a long-term diabetic and been experiencing unstable blood glucose levels at the moment. So that's what we're going to do today. First thing, you know your assessment station is 20 minutes. It's normally with a real actor, obviously real patient who is going to be an actor, and means doesn't matter whether it's in community or is in hospital setting, you're still expected to do certain things in assessment station. Marking criteria is the same. Okay, so the first screen. So first thing you're going to get is a scenario. So you read your scenario. It means patient history. So because you can't carry out an assessment on a patient if you don't have any history about them, so this is given to you. So you read this, but there is no extra time for it. You read this within 20 minutes. Okay, so as soon as your timer starts, you can read this before you do the scene safety and closing the curtain and all that. So it makes you understand your patient needs a bit better. When you look at the history, you know they're presenting symptom and diagnosis. Okay, so obviously for this patient, now I'm not saying by any means this is the same scenario as exam. No, just as example scenario of a diabetic patient who is living at the moment in a nursing home, and GP has asked you to go and visit this patient because they are having unstable blood glucose levels. So it's very simple. So like I said, it doesn't belong to a real person. I've just only made it just to show you an example scenario. I'm not saying it's the same as an exam, just an example scenario. What can you possibly see in for this scenario in exam? Okay. So this lady obviously is in nursing home at the moment. She's experiencing unstable blood glucose, as you can see. I've highlighted, and the GP has already also asked you to complete a must tool on this patient, which is malnutrition tool, malnutrition universal screening tool. So that's normally what you've been asked to do in your exam as well. Okay, and you can see there's patient history, past medical problems, social history, allergies, and so on. Okay, so that's just a standard template, but this particular patient will have information on that template you can read. Okay, so that's what you need to do. So next thing is, so what documents you got to complete in this scenario? There are two documents. First is the news chart, because you do need to do the patient vitals and plot them on the news chart, work out the monitoring frequency and escalation. So that's standard. So you have to do the vitals for this scenario as well. So you will be completing news chart. Another paper you will see is the must tool. Normally, if for your community scenario, they give you a malnutrition universal screening tool to complete for this patient because they are experiencing malnutrition, because being long-term diabetic. Okay, so that's what it is. That's the paperwork you get. And obviously patient history form, which I shown you on the first screen. So those three documents. So your patient history form is to read, not anything to document for you, just to read. But the chart your examiner is going to mark is the news chart. You need to complete that correctly. And also the malnutrition universal screening tool, which will be given to you as you can see on the screen. So that's what you get. Okay. So what do you need to do in 20 minutes? So that's the paperwork sorted. So what do you need to do in 20 minutes? So let's have a look at the next screen. You need to take the vitals like we do for any scenario, any assessment station. I have already done lots of videos on assessment station. If this is not making sense to you, please go and watch those videos first. I have added the link for those videos to the description of this video below, so you understand what an assessment station is. Okay, because we are not going through the full assessment station here. I'm just going to tell you what is particular for this diabetic patient. So we're going to take vitals, which we do for any scenario, so we will take it for this patient as well. We need to conduct the full A to E assessment as by the marking criteria set by the NMC, which is already I've covered in my other assessment videos, so go and have a look. And then you need to complete the news chart, which we know that if we are done the vitals, we need to plot them on the news. We need to verbalize the monitoring frequency, total score, escalation. So that all has to be completed. Again, there is a video on the news charting. I have done 2 different videos on news charting, so you can go ahead and watch those. Again, the link of those videos to the description of this video below. Next one is that you need to carry out the holistic assessment, which is part of your assessment station. It means you're going to look at the physical needs, couple of activities of daily living, 2 or 3 problems, nursing needs, psychosocial, any psychosocial need for your patient, any family need would be included in psychosocial, any spiritual or sexual need, including completing and addressing must tool. So that's the extra bit in this scenario, where if the patient was in hospital, you're not asked to do any screening tool. But if for this community scenario for a diabetic patient, you are most likely to be asked to do the malnutrition universal screening tool. So you need to complete that as well. Right, okay. So that's what you need to do in 20 minutes. So quite a lot, but must tool is already completed for you. All you have to do is add the score. Okay, so we're going to look at that next. So as you can see, so just imagine now that you have done the vitals on this patient, you've done the A to E assessment, you have completed your news chart. Now we're going to move on to the next step, which is the must tool. Okay, because you do need to look into their physical needs, and as part of the physical needs we will look into eating and drinking, because this is a diabetic patient. So we can look this is our chance now to look into the must tool, which examiner has already passed you the paper in the beginning. Okay, so if we look at the must tool here, you can see BMI, and the details are already filled in for you. The BMI score is given to you as I've highlighted on your form. The weight loss score is already given to you. So you're not figuring out any BMI or weight loss. It's already circled for you, okay? Now, acute disease effect is the third element in must tool, but that does not apply to community scenario. So normally that's not scored. So don't worry about it. If it's not scored, that's absolutely fine, because it normally does not apply to patient in community. So it's the BMI and weight loss. So as you can see, all you have to do is, as you can see on the paper, I was given a BMI score of 1. I was given a weight loss score of 1. Score 3, acute disease effect was 0, because it was not circled. It means it's 0. If it's not 2, it's 0. It doesn't apply to community scenario, so it's 0. So the total score is 2, and that is high risk. Okay, as you can see on the chart. So you will say, okay, I'm adding up your score. Your BMI score is 1, your weight loss score is 1, your total score is acute disease effect is 0, total score is 2. It means you're at a high risk of developing malnutrition. Okay, so so what do we do about it? Okay, so how do we address it? So like I said, you need to complete, and then you need to put the sign at the date and the sign signature. So it's asking you to put date, time and signature. So make sure you definitely add that. Okay, so you do need to add the score, you need to add the date, time and signature, but the BMI and weight loss is already given to you. Okay, so once you completed this document, an examiner will mark that you have signed it, 80 days, scored it correctly and all that. Then you need to discuss how you are going to address this malnutrition for this diabetic patient, and that will become one of your nursing needs as well, to write in your care plan for planning station later on. But this is the one you can discuss as part of physical problems. You will discuss, okay, I can see your malnutrition score is 2, which is high risk of developing malnutrition. I'm going to refer you to your GP and also to a community dietitian. We will repeat this assessment for you in 1 month time, and then you going to, if this is due to reduced oral intake, or what is the reason? Explore the reason. Is your patient eating well? If they are eating well, what kind of food they are eating? Okay, because they're diabetic, so maybe they are not eating maybe they are not eating complex carbohydrates, or they're eating sugary foods or sugary drinks. That might be the reason for their malnutrition. It may not be just simple reduced oral intake, it may be another reason, but you need to explore. You need to explore the reason. Is it a reduced oral intake? Is it that your patient is eating enough but they're eating wrong food? Being diabetic, maybe they are having white rice, white pasta, white bread, which are not good for a diabetic. They will make blood sugar unstable, and it could be that they're having sugary food and drinks. Okay, so again, you need to look into the reason, talk to your patient. Okay, and encourage them to have well balanced diet. You have already referred them to a dietitian and GP, which is important. So that's what you need to verbalize to your patient, that those actions which are put on the screen for you, so they will be important. And working out why your patient is having malnutrition, what's the reason. Ask them how much they've been eating, what are they eating, how often do they check their blood glucose level. That's all important things in addressing this malnutrition issue for a diabetic patient. Now, next is, so you done this, then you pick up I always been asked, oh, what else I can discuss as a second nursing problem for my patient for diabetes. Now work on your scenario, what information they have given you, and also think about what does diabetes affect long term, like or day-to-day things like sleep. Are they having disturbed sleep because they're going to pass urine few times a night, they're getting up? Is that disturbing their sleep? That could be something you can talk about. You can also talk about, this patient normally has in your exam history of recurrent UTIs, urinary tract infection. So you can talk about how to reduce the chances of a urinary tract infection with your patient. You can discuss to increase their oral fluid, water intake, well-balanced diet, maintaining blood glucose stable levels by eating well-balanced diet, and that will help to prevent urinary tract infection, because that's the reason for urinary tract infection is the unstable blood glucose level, and passing urine regularly, no holding, and general obviously personal hygiene. So you can talk about all those things to prevent a UTI, and educate your patient on symptoms of UTI. If they do have it, then to ring the GP and all that. So you can talk about that, preventing urinary tract infection by improving blood glucose control and by increasing fluid and all that. So you can talk about that, or you can talk about mobility. Normally this patient is experiencing a little bit reduced mobility as well due to increasing age and also being diabetic long term, which is affecting their muscle tone and stuff. So you can talk about that, but it will depend on you what scenario they have given you and what information they have given you. But these are the main things you can kind of discuss with your patient. Couple of things. So malnutrition will be one, and the second thing you can talk about maybe chances of developing UTI or sleep or mobility, depending on your scenario. So, and then you will ask your patient if they have any questions for you, tell them that they should ring the GP if they have any problem, and then you finish your station. And of course, you are going to talk about their psychosocial, spiritual, and sexual needs anyway, which I have covered in my another assessment station. So you can watch those videos. They are not particular just for diabetic patient. We discuss those for any patient in assessment station. So you would do that anyway. This is, I'm just going through the specific things just for this patient. So you do need to include those things anyway before you finish your station. So I hope you get a better idea now what paperwork you're going to get for a diabetic patient, what kind of things you're going to discuss, and what things you need to put a little bit more attention on, like how to complete malnutrition tool and how to talk about other things which diabetes can affect. And like I said, don't forget to include their other emotional psychosocial needs or spiritual needs and everything else. So this is just a summary how do you need to do your diabetic scenarios. I hope you like the video. It gives you some benefit and give you some tips how to carry out this station. So if you like my videos, please press the like button now and subscribe to our channel. You can also check our Google reviews on our Google advertisement page, what nurses have been saying. We are very proud to have very, very high first time pass rates for our training. We're really proud, and of course congratulations to all. And then you can visit us on OSCEnurstraining.com and email us on OSCEnurstraining@outlook.com. I will soon be back with another video for you, so bye for now.